So in the U.S. healthcare system, it's a very fragmented health system of sorts because of the way healthcare is consumed, but also how we pay for healthcare. So biggest challenge in the U.S. healthcare system is how do we bring together disparate information sets from various providers in the ecosystem and homogenize it in a meaningful way. Horizon's mission is to empower our members to have their best health, which really means is that how do we remove any of the friction in the healthcare marketplace to the best we can on the side of the insurance aspects of the healthcare continuum. We want to engage our members early and often. We want to make sure that they are getting the access to healthcare that they need and making sure we're building tools and technology that really empower them in a meaningful way. When you look at a risk profile of a member, or you look at other factors which are not healthcare components, where they live, do they have access to care, do they need translators because they are not English speaking, all these aspects of what we're calling determinants of health outside of the healthcare continuum are all important factors. So we look at things and say, are we now creating packages or benefits that are appropriate and useful for these individuals is where data and analytics plays a big role. We're using Teradata as a key component of that is this notion of building a feature set. When you look at healthcare data, a particular individual may have 5 disease types. They may be taking different medications for each of those disease types. And we may want to do disease interventions. In order to identify if this one individual participates in all these different programs or can be considered eligible for all these different programs that the organization offers, we have to build what we're calling a feature set. And for an individual, it could be like 2,500 feature sets we look at. And we run all that, and at the end of it, we create flags for every individual. If you say to me, show me all the potential people who are turning 65 next year, and we want to advertise with our Medicare Advantage program, we can build a cohort on demand. So this idea of building a feature and flag system that allows you to build dynamic cohorts on demand is pretty amazing for us in terms of how we're doing it. And that's very unique in terms of a use case that brings together both the data and the insights together in a meaningful way. For the feature sets, we are using Teradata with native object store, and we're exploring the open table format now. Teradata is our business data hub. Teradata brings all this disparate data together, integrates it, and harmonizes it. And when we say harmonize, we're really talking about building data products, or in other words, a data catalog. So we are going to say to our downstream consumers, if you're interested in population health, you need catalog A, B, and C to be combined. If you're doing value-based care, you need catalog A, C, and D, because each data catalog is a specific area of focus of analysis, and that's all done on one platform today, Teradata being that platform. Our data is organically expanding at about 18% a year. So we knew that having an on-premise environment was not sustainable or scalable. Teradata, to me, is a means of bringing and harnessing the power of data that an organization has. We're able to bring the power of what data can do for you in one place in a reliable, scalable, and a consistent way. Teradata has been that consistent force powering our innovation and also accelerating our analytics. Our job is to make sure when a member wants to purchase healthcare for whatever their requirements are, needs are, we're able to do that quickly. We're not making them wait. We're not telling them 18 options that don't make sense to them. I want to be the Google Maps or the Waze map or the Apple Maps for my member at every stage that they need somebody to intervene on their behalf. If I can do that well, I think I've done a great job.